Thank you. The gentlewoman yields back, and I now recognize my dear friend from Iowa, Dr. Miller-Meeks.
Thank you, Madam Chairman, and I want to thank the witnesses for testifying before the subcommittee today. 3 years ago, we were asked as a conference to be on certain task force, and so there was a Healthy Future Task Force, and I chaired the subcommittee on modernization, and with the chair of the current subcommittee on health, and we focused on AI, data interoperability, devices, technology, and how it can help with both access to care, affordability, prevention, and better outcomes. So I'm delighted for this hearing today and for your testimonies. And earlier this summer, I hosted a bipartisan briefing to spotlight how artificial intelligence is transforming clinical practice and patient care. And thank you, Dr. Toy, for assisting the provider, augmenting the provider rather than replacing providers or physicians. During the briefing, we heard from Dr. Michael Abramoff from the University of Iowa about how his company, Digital Diagnostics, is using AI to tackle diabetic retinopathy. In fact, it's, I think, the first autonomous AI device to be approved by the FDA, Dr. Abraham. And his diagnostic device is now used in numerous healthcare systems around the country, and it underscores that AI-powered diagnostic platforms can be deployed safely while improving patient outcomes and healthcare productivity. So, Dr. Toy, your testimony mentions the importance of interoperability and standardized data access for effective AI performance. How can Congress help accelerate interoperability across federal and private healthcare systems in a way that encourages innovation but avoids imposing rigid one-size-fits-all technical mandates?
Yes, thank you for the question there. I think the key on interoperability is AI runs on data, and the better, more relevant the volume of data, and also like the more personalized that data is, the better the AI is going to be able to run. So it's critical that we have built infrastructure around healthcare interoperability. The current rules that we have on the books right now, I think that it would be wonderful if we could focus on modernizing those particular areas. I would point everyone to, for example, HIPAA. HIPAA does, good work. The intention of it is very good, but it was originally developed in a almost pre-internet world, let alone pre-AI world. And so the intentions of portability and the intentions of accountability in HIPAA must remain, but we must update some of those regulations, I think. Otherwise, they will start to hinder interoperability.
I think that AI has tremendous potential in healthcare, as I have previously mentioned. I'm going to discuss some of the dangers of AI. We know that older individuals have less trust, but that younger individuals who have grown up in a world connected remotely or by the internet have greater trust in these systems. And we know that they're looking towards, at the same time, the internet and social media platforms to address loneliness and isolation and connectivity exacerbated by the pandemic, but it's a source of bullying and threats to them. I'd like to enter into the record an article, August 26 by the New York Times, a teen with suicidal, ChatGPT was the friend he confided in. The tragic story of Adam Rain, as reported by the New York Times, has ignited a difficult but urgent conversation about the role of AI in mental health support. I'm not going to list everything because my time is running out, but his parents are now suing OpenAI, alleging that the chatbot became his closest confidant and ultimately a contributor to his death. And Dr. Wright, in your testimony, and we have very little time, direct-to-consumer chatbots are making deceptive and dangerous claims, with one presenting itself as a psychologist that validated a user's violent thoughts. And where should the boundary lie, if you could be brief in your comments?
Well, again, I think that the boundary really lies in ensuring that these types of chatbots, don't misrepresent themselves, that they're not allowed to call themselves a licensed anything. We wouldn't want them to call themselves a licensed lawyer. I mean, we would not want that because it gives a sense of credibility that doesn't exist. I think that we also have to build better chatbots. I mean, I think everybody deserves therapy. Everyone deserves human one-on-one therapy. That might not be what everybody needs. So we need to think about how can we actually leverage emerging technologies, personalize them in a way that actually reaches people where they're at. We have a system that waits till people get in crisis. What
Yes,
if we
so
could
I'm
get
going
to them
to,
first?
I'm running out of time, but you mentioned the human connectivity and everybody, that interaction and parental oversight. And I just want to emphasize that groups, programs, schools that are pushing to exclude parents, prohibit informing parents of children's activities when at school, it actually undermines the very human connectivity and support from those groups and those parents and those families that our youth desperately need. Thank you, and I yield back.